Hello there, my name is Antoine Cass. I'm one of the Urology Clinical Research Fellows. I work at the University College Hospital in London. I am trying to make a series of videos to talk about the problem of urinary incontinence or leakage of urine after prostate surgery. This is a devastating problem that affects men after their surgery. The surgery is usually performed to remove the prostate gland because of prostate cancer with the aim of curing patients. However, during the process of performing the surgery, some damage can happen to the sphincter muscle, which is the muscle that lies just below the prostate, and that damage can result in a weakness of the muscle. So after the operation, patients start to notice leakage of urine whenever the pressure inside the abdomen increases. For instance, when patients stand up, bend down, cough or sneeze, or even walk about, they notice that they are leaking urine. And this becomes gradually a distressing problem because it does limit patients' activities, and they start to become very worried about the embarrassment that the leakage causes them. And some of them avoid socializing and become isolated and withdrawn, and a great proportion develop eventually a clinical depression. Now, as horrible as this sounds, the good news is that there are too many treatment options. And also there are too many incontinence products in the market that help at least patients cope with this problem. These products include things like, briefly, like pads, penile clamps, penile sheath or condom sheets, etc., and too many other options, which I'll talk about in future videos. And then we go into the treatment options, and these include the conservative options like pelvic floor exercises, biofeedback training, bladder training, pelvic muscle electrical stimulation, and then the surgical treatment options, and these include the male sling and the artificial urinary sphincter, which is the topic of a randomized controlled trial we are running at the University College Hospital to compare these two treatments. Therefore, and that was actually the trigger for me doing those videos, because I see too many patients in the recruitment clinic as part of the trial who suffer from urinary incontinence, and I feel passionate about the subject because I see how much suffering and pain these patients go through to deal with this problem. So the aim of the videos will be educational in the first place, to know what is available out there in the markets and to help cope with the problem, and then what are the treatment options and which option to choose based on the advantages and disadvantages, also based on patients' fitness, priorities, and the degree of incontinence, which is of paramount importance. So stay tuned for my future videos, and I hope that they will be beneficial for patients who have the prostate surgery, or for patients who are unfortunate to be diagnosed with prostate cancer and who are considering prostate surgery, so you know what to expect afterwards and what are the treatment options for the complications that can result from having the surgery. Thank you very much for watching this.